All right. Well, I'm going to go ahead and let Felicia and David do some quick intros, just so everybody gets a feel of who you guys are and what we're going to be talking about.
Okay, that sounds great. Dave, do you want to kick it off? Or I could go first. So, hi
Okay.
everyone. My name is Felicia Agbanyo Hammond. I'm an adult service coordinator in the Worcester area office. So, I coordinate supports for people who have developmental disabilities or autism spectrum disorder.
Hey, I'm David Downing, and I am a Grin One dad. Yeah, I don't think you can see. I have a 27-year-old Grin One daughter, and Felicia has been supporting us the last couple of years since Madison aged out of her uh, school program. And I thought it'd be a great idea to have Felicia join and sort of walk everybody through what it's like to have an adult to support one of our kids when they become adults, because it does happen
Mhm.
eventually. So
Yeah, and I have a 10-year-old stepson with Grin 2B, and I know that this topic has been pretty um, important for a lot of our families in the last 6 months to a year. So I'm really excited to be a part of this conversation too. Even though my son's only 10, we are looking down the road too. So I'm going to start off with a question for Dave. Dave, how did your priorities change when you stopped focusing on early intervention and started focusing on long-term quality of life for Maddie?
so we probably, I think, probably around 2015, um, we it became really kind of apparent. Well, we were always kind of aware that we were going to have to figure out what we were going to do long term. And in 2015, my wife basically said, this is nuts. You can't be carrying her up and down stairs anymore. Um, you know, and we started kind of we need to get into a house that has a first floor bedroom that, kind of all that kind of, all those kind of thought processes really kind of became front and center for us. So probably, I mean, Madison was maybe, at that point, um, you know, in her teens, 14, 15, 16. And so that's kind of when we really started thinking about it. And then, you know, the, um, and she was, and then we kind of, at age 18, she left her high school and, and went into like a post kind of graduate kind of program. So we really became aware that ultimately, age 22 in Massachusetts crops up on you, and, you're going to have to support support her. But we, honestly, I was thinking about it a long time ago. I was aware that we were going to have to kind of get to some point where this young little person was was now like an adult woman, right? Who we were supporting. So it was a while back.
Okay. Felicia, what are the two or three most critical legal or medical milestones families need to prepare for as their child approaches 18 and 21?
That's a great question. So, a couple of things that parents should be looking at is whether they want to do guardianship for their child or informed decision making. Guardianship isn't for everyone. And now, courts, at least the courts in Massachusetts, they're actually looking more at limited guardianship. So, really supporting somebody in their independence and what decisions can they make? How do they communicate? But those are two big pieces that people should be looking at towards somebody's 18th birthday. Is that, are you going to make informed decisions? And if that's the case, something like a healthcare proxy should be put into place, or looking at the guardianship process because it can be pretty lengthy. And depending on the supports that you have in the state that you live in, you could have help for guardianship through like an area office, through like a service coordinator, or that might be something that you have to kind of do and engage with on your own. But the sooner you start planning for those things, the better. Also, looking at different supports that you're eligible for. So sometimes people are eligible for PCA services, or adult foster care. So having things like that in place, and then looking at supports like SSI for payment, those different supports and those different pieces to the puzzle. People should be looking at that as people turn 18 and then as they turn 21.
Okay, I'm actually going to add in a question that's not on the list today. Is
Mhm.
there anything related to, I know a lot of our kids are probably on Medicaid and things like that. So with insurance, if people are, you know, sorry, I'm phrasing it in my head as I'm trying to get it out of my mouth. So a
Yeah.
lot of people can stay on their parents' insurance until they're 26.
Mhm.
How does that play a role in this as well?
That's a great question. So I can only speak to Massachusetts, and I can kind of give a high level overview. I know that there's different point people in each state that people work with, as far as service coordinators, and that's going to look different depending on where you live. But my answer to that, because it's so varied, is really engaging with your service coordinator and saying, what supports am I eligible for because my child's on Medicaid? What supports are they eligible for? Because parents may be eligible for something different because of their child's eligibility. Like PCA services, I saw that in the chat. That's a personal care attendant. Um, so somebody that's in the home, they could be a paid caregiver to their child. You can also outsource that help and hire somebody that comes into your home and they provide the personal care attendant PCA services. Adult foster care, some people can qualify for adult foster care, and that's just termed AFC. Um, the Massachusetts model. So if somebody's living in the home, say, if Dave wasn't guardian, say, or Maddie's mom, she could be qualified as an AFC provider because she lives under the same roof as Madison. So situations like that, you just want to talk to your service coordinator or whoever your point of contact is that's helping you kind of navigate services with your child and talk about those things as early and as much as often because 18 and 22 come up really quickly. And the more you can plan down the line, the smoother that transition will go because there's going to be bumps in the transition. And Dave can speak to that. There will be bumps.
Yeah, no, there's definitely bumps in the transition. I think that what I would add is that, so like regarding PCA services, which were kind of a really important thing that I figured out pretty early on in the process. So there's like special rules. Like I'm Madison's guardian, right?
Mm-hmm.
But that means I can't be paid to care for Maddie, but Benita can. So in the case of how we work it in our house, you know, um, Benita works a lot of hours. Basically Benita is getting paid to do sort of multiple roles that we're basically sharing, admittedly. But I think that so for Madison's PCA services started when she was maybe 13 years old, and it started. I mean, I'll admit it was like maybe 15 hours a week that we had, and I think I paid the kid across the street, and she's now a nurse in Massachusetts, by the way. But like I paid her, like she helped us. I mean, honestly, I don't know what she was really doing other than probably distracting my other daughters, which was great help. I mean, we take it help any way we can. It's not really probably what she was supposed to be doing, but it's how it worked. But I think that it was but those PCA hours are now like 120 hours a week. I mean, because Madison is a handful, right? She's a 27-year-old woman who needs constant care and attention. So, that is an important component of what we're doing. There's also she's also at this when she turned 22, she became eligible for a waiver program through the Department of Developmental Services, which is another kind of bucket of support that exists out there. And I would say that in terms of Medicaid, so Maddie was always on Medicaid. I had health insurance. I used to work for Oracle. I worked until just a couple of years ago. There was, I would check your states because there's certain states that will, pay for your health, private health insurance so that they can bill Medicaid against that. Those are in Massachusetts. There's a program called the Kaylee Mulligan program, which Madison participated in since she was like an infant. I think that there are, and today, even now, Medicaid, I was just on with them like 2 weeks ago. They're going to come and provide PT and OT and some, services for Maddie in addition to nursing. So, Medicaid has supports. You have to, navigate your own system. It becomes a full-time job if you haven't already realized it. It's like a little game you have to play. But,
I do think that's
you learn it as you go, as you know.
That's a great point that you bring up, Dave. Kind of looking at what works for your family, because Dave's right, as at least in Massachusetts, and I'm pretty sure it's a US wide thing. If you're a guardian, you also can't be paid to provide a service. So looking at who's in the house, and talking to your point person that helps you coordinate supports and saying, I think that I'm going to be guardian, or we know that one of us wants to be guardian, but we would also like some in-home care. And what does that look like? So you want to make sure that you're having those conversations. So you're not setting up your family in a way, if Dave and Benita were both guardian, then there wouldn't be able to be like AFC. There could be outside the home PCA services, but be able to be somebody that's a guardian to Maddie.
Yeah, it's kind of the other thing I would point out, and you would never even think this, but a lot of the funds that come back through the government to you to support your child are actually, the IRS has rules. There's a lot of that funding is tax free. That it doesn't count as earned income. So you got to talk to your accountant and like find people who kind of know a little bit about this. But once you figure it out, it is pretty sort of straightforward. And but it's, we do a ton of evaluations, a ton of nursing evaluations in our house. We have people in, it feels like at least every month. Felicia's in our house. Like somebody's constantly there, which is great and fine. And, but it's a different process than probably what you're used to in dealing with schools where, you go and do one IEP every 6 months kind of thing. I mean, it's a little bit more rigorous, as it should be. But, I think you sort of learn it as you go, as I've said a couple of times now. You'd be amazed how knowledgeable you become in things you never thought you would ever have to know anything about. But kind of the way I would put it.
Yeah, that's very true. And I'm seeing some comments in the chat that the PCA can be dependent on the state. So Pam in Wisconsin, correct me if I'm wrong, but said hers is independent of guardianship. And then Katie, Katie's in Wisconsin. So the guardian can get paid for caregiving. So
that's fantastic.
Yeah. And like with a lot of things in the US, it's really going to vary state to state. So.
It is. It's very much state to state.
Yeah.
And, but you sort of, but these are super important programs for us to advocate about. And they are, if you're thinking about the long-term care of your child, you all of a sudden become really aware of what, people in government are saying about these programs. And, it's like, this is very important to the support of your family, going forward. So, I mean, I would tell you that it really sort of became for us, it was like, as we were sort of transitioning from, I was working full time, Benita was working, we had Madison, and then, we had two older kids. I mean, you're sort of juggling a zillion balls, right? with you raising families. And, you know, then Benita started working just mostly full time. And then, you know, Madison's needs just totally changed. And the pandemic happened and she aged out during the pandemic. I mean, it was really kind of crazy, but you, you know, ultimately the system is there to support you. You just have to kind of work, you know, wade your way through it some days.
Yeah, absolutely. So I'm actually going to go to the chat. I know we're probably supposed to save questions for the end, but I'm going to kind of go through them. Sarah asked if anyone has used ChatGPT to navigate any of these programs.
I would not advise that. For a broad overview, you can go to ChatGPT, but I really would connect with whoever is your designated representative to help navigate services because they're really going to know the ins and out. So just for fun, the other day I put something into ChatGPT because I wanted to see if they knew some of our service coordinator acronyms. They gave me totally something unrelated to what I was looking for. So I think when it comes to navigating the services of your child, you want the most accurate information. And that's ultimately that's my job. It's my job to know these supports. And if supports change or things are updated, policies are updated, it's my job to stay up to date. So you really want to connect with somebody that is working in these supports day in and day out. But that's a great question because ChatGPT can do a lot.
Okay. What does independence look like for a GRI adult? How can families support autonomy while ensuring their safety? David, if you want to give us
So I'll start with that. So, and I think it's, you know, obviously GRI is a giant umbrella of different kids, right? So, in different requirements. My daughter is very severely disabled. You know, she's needs 100% support, and you know, she's not going out and to you know to the community to do work. I mean, that's obviously not happening. But I think that with even for her, like her medical needs have kind of become so big over the last couple of years that we've really not even been able to have her be in a day program because it was just, you know, getting her, you know, she has a special like bowel regimen that she's in now that takes up a substantial part of our day. So really for us, you know, we're probably at the very high end of the spectrum for needs, but I know that there's day programs and there's also, you know, I mean, the system is there to support you if you're, you know, depending on where you live, it probably looks different, but you know, there's great, you know, it's not the level of attention you're probably used to in a school, public school, but it is, you know, there's you know, there's a lot of support out there. Felicia probably can say it in a different way, but
No, I think that's great. Exactly what you had touched on is really looking at your adult child and kind of seeing the person that they are, what their needs are, and also what they would like to do. Um, so in across the states, there's two different service models, which is either traditional services and like Dave was saying, that's going to day programs. And for some people, that works out great because, you know, it's a Monday through Friday thing and your child can go there and they're there for 6 or however many hours a day and then they come home. So for some families that's what makes the most sense because they need that structure and they need that consistency. There's also self-direction. So I'm a support broker and it's basically somebody that kind of helps people manage the self-direction part of their services. Oh, I'm not sure if I had just dropped off.
no, you're there.
Okay. So self-direction, it's high flexibility, but high responsibility. So when somebody's in self-direction services, unlike going to a day program that's fully staffed and has their own set hours with self-direction, it's up to the family to hire staff and also train, manage staff, but it really is flexible to the family's needs. So with a self-direction schedule, say somebody has, 30 hours of their day program services, a figurehead, it could be a parent, it could be the person themselves that has the disability. They're hiring the staff and saying, okay, I want a staff to take me out from 4 p.m. to 8 p.m. 3 times a week. So there's a lot of flexibility with that. There's also hybrid services. So you don't have to do all traditional or all self-direction. You can do a mix of services. And in some states, there's this middle ground called agency with choice, where the agency, they'll pick and hire the staff, and you also have the flexibility to do what you want with your day services. So you're not necessarily going to a day program that's a set building, but an agency will hire staff for you, and then you get to let the staff know what you would like to do for your day-to-day schedule. So kind of looking at the person in the center, what are their needs? Some day programs do a great job of getting people out in the community. Other day programs are more center-based where they're doing activities. Self-direction, you do that out in the community or you do that out in the home. So there's people that I work with that do like adaptive horseback riding, that do adaptive skiing, adaptive kayaking. So again, high responsibility, but high flexibility. And it just depends on what the person at the center needs.
That's great. And I on just a personal note too, those kind of resources are so wonderful. I'm in Indiana, and we actually have the amount of resources that we have for our son are surprising to me sometimes, just because of where we're located. But I love the programs that you need to cater to the person. Not just, it's not a one size fits all. So it's wonderful to hear about all of those different things that are available for our kids, even when they're not kids anymore. So
yeah, I think the other thing that we kind of didn't really talk about, and I think it's okay to talk about, is that there are people who don't, who say, they get to a certain age, they say, you know what, my child and our family would be better off if somebody else was taking care of our child full time. And I think it's okay to kind of have that discussion and put it out there, because I think it's, what we do caring for these kids is an absolutely incredible amount of work, what we're doing. And, we certainly deserve at some point in our life to enjoy, enjoy our life. I think so. I wouldn't begrudge anybody who said, "Oh my God, I can't do all that responsibility. Wow, I've done this for 20 years or whatever." I mean, let's enjoy your life. It's this is not you weren't sentenced to something. You have to, you just by participating even in this, we're all doing so much. So.
Yeah, that's a great point too, David. I think a lot of parents in general just hold that burden, and then, or I hate to say burden, but it can feel like a burden. And then when they do get that break, they almost feel guilty. I know there's been times that Hunter, on just me relating to this, Hunter's gone into respite care for a week, and we have like a weight drops off our shoulders, a sigh of relief, almost like in tears, because we need that break. Parents, we have to take care of ourselves too, and it's
yeah, we do. I mean, I think as well, it's not like Felicia has heard me complain about this. There is no, there's respite per se. Like in Massachusetts, we have respite. I mean, there's funding that exists, but there's not a lot of respite. Finding respite facilities for adults with high needs it used to exist. It doesn't exist anymore. So, I think you have to really think about the fact that, longer term, these are, you do have to have a break, and you have to say, you need that downtime to be able to go, not think about, because this is a job, right? It's an intense job that you're doing, 24/7.
And there are those supports that are available. And that's something that, again, because it's a great point to bring up. I know that it's a really difficult conversation sometimes for parents to engage with, but the sooner that you can talk with your service coordinator about laying all the options on the table, it's just information and people can do what they want with that, but it's always great to have all of the information so you can make the best choice for you and your family, whether that's keeping your adult child at home, whether that's looking at group homes. There's also a shared living model where depending on the need and support for somebody, they can live in another caretaker's home. So it's not necessarily a group home that has 4 or 5 other people. It would be like with one family or one person, and there's different people that they would be matched up with. There's a lot of, so something that in Massachusetts, there's quite a few retired nurses that will want to do shared living after for people that have clinical supports or, people that have a mental health background. They'll do shared living with people that need significant behavioral supports. So there is a place for everyone. You just want to be talking about those things often and early so you know what options that you have.
Good, very good points. I'm going to jump over to the chat really quick. Rachel asked if are you able to address possible options for our kids when we are no longer around to care for them due to our own age or passing away? It's an uncomfortable topic, but it's a topic that's come up a lot in our household too. So I know it's a big one for our families.
Yes. And again, I can say this with a caveat. So I worked in the state of Massachusetts, and I'll just talk about a high level overview of what we do in Massachusetts. So there's something called a prioritization process, and people go through what's called a MASCAP. And basically, it's an evaluation, a whole evaluation of your adult child, the family, what the needs are. And then that gives a good idea of what kind of placement this person's eligible for, because a guarantee is none of us will be around forever. So we do want to look at what comes next and how to support the person in the center of these supports after you're gone. And also for some people, it makes sense to do that, before they're totally unable to care for their child, because if they're placed, then it becomes more comfortable for your child to see you, to know that they're in a safe place, for you to know and see the staff that they're with. So there is a process for that. And depending on what the family's looking for, again, I'll keep on saying, talk to the person that helps you navigate services, because it's a different conversation when somebody's 22 and the family saying, I just think that this would be the best choice for all of us as a family, for them to be moving into some sort of other living arrangement than it is when somebody's not able to care for them.
Let's see.
I'm sure people to put together, like, even if you had a will, you can put in, like, this is what we want for our child. You can speak to an attorney, somebody that you wanted to make sure there was a plan in place in case of emergency.
Yeah, and that actually fits into this question in the chat also. If the topic of a special needs trust has been addressed, this can be crucial for kids with disabilities, especially if they outlive their parents or caregivers.
Yeah. So at least in Massachusetts, there's something called ABLE accounts where people can put their funds in so they don't go over assets and they don't lose certain benefits. Again, talk to your service navigator so they
Yeah.
can help you navigate these things, because you do want to make sure that your loved one's set up after you're not around, but you also want to do it in a way that it's not leaving them ineligible for certain things. So we can be creative with how things are categorized, but you do want just help navigating that.
Absolutely. I actually, my husband and I had that conversation with one of our financial advisors several years ago already. Haven't actually gotten anything into place yet, but it's, yeah, you've got to be careful with that kind of
Yeah.
stuff. Yeah.
Well, I will. Yeah, and I will tell you, Brittany, that the thing that we did is actually, so when Madison was probably 2, so this is an eon ago, we had a will set up, and the way the will is set up is that we have other children, and so it was divided, a third, a third, a third, but the money, in the will, it basically says that if Madison, something happens to us, like Maddie doesn't get any money directly, a trust is at that point created, and all funds go into the trust then. So really, like, it was like we didn't have to do anything. We just had to write it out in our will that when something happens that, trust is created. So, you don't, again, it's like talk to somebody who kind of knows it. And, lots of families go through this, not just Grin families.
Yeah, yeah, absolutely.
So,
Yeah, it looks like that. Yeah, so some other people are chiming in with definitely find a lawyer for that does special needs trust, or someone else said that their local credit union was incredibly helpful regarding setting up an account for her son's disability benefits.
yeah.
So there's definitely options out there for that too.
Yeah. I mean, but there's like, once your child turns 18, and like if there's SSI, and like Madison does, she has a representative payee account, and that requires, I have to do a filing for that every year. And then I'm her guardian, and so I have to file paperwork for that, it takes like 15 minutes. It's not a big deal. Let's just do it online. But there's documentation that has to be filed. So there is like there's an extra layer of care that goes in once they turn 18, and all of a sudden that they're an adult, you're the guardian, or there's some arrangement set up, the steps that you're going to have to take, but they're obviously doable.
Yeah. Let's see. I'm going to go back to the last question on my list. Going to change topics, and then we also have the Q&A. We have time for Q&A, so I will get to the questions that haven't been answered in the chat yet. So how do we ensure our adult children have a social life and meaningful daily engagement once they age out of the school system? I think this kind of probably ties back to some of the day programs and other things we were talking about before.
I would say it's great for families to get plugged into family support centers. At least in Massachusetts, that's the model that we have. So, like, out of my specific area office, we're connected to 2 different family support centers, 3, because our autism support center is different. But it's a great connective place that puts on events and outings, not only for the people that have disabilities, but they have care groups and support groups for families, and just meetups and coffee chats, because it is really important to have that community piece, because being in the world of disabilities can feel very isolating sometimes. But when you meet up with other parents that are going through the same thing that you are, and also when your child can find connections outside of the family, like that really helps them thrive too.
Dave, did you have anything you wanted to add to that?
Not to that, but I will say there's kind of another topic I would mention that's important to talk about, just in terms of going to adulthood, is that eventually, you age out of the children's hospital system, which is a whole nother kind of good topic to maybe another session to have on, because that also is, all of a sudden at about age 20, 24, 25, certain people that you've talked to, for us, what happened is that, everybody that we've been dealing with for like 20 years gone, and now you've got a whole new set of people that you know, from, you no longer have a pediatrician, you have a PCP, your child has a PCP. That person has never heard anything about GRIN. They don't know anything, you know, they're seeing your kid for the very first time. So that's a whole nother level of, you know, that happens when all this adult aging is kind of happening, that you have to kind of be aware of. And you know, it's just a different, it's just adds another level of complexity sometimes.
Yeah, that's a good point too. Very good point. Okay, so I'm going to catch up some of the questions that are in the chat that we haven't gotten to yet. Anybody, if you have any questions for Felicia, Dave, or myself, but I'll probably let Felicia and Dave answer most of these questions. Just drop them in the chat for me. So I'm going to go back to Melissa's question. Who do you go to in order to establish if your child qualifies for supportive living? Her son is mostly typical, but she's not sure he'll be able to be 100% independent as an adult.
So I'm assuming that the child is school age. So in Massachusetts, again, we have family support centers where people can go and they can get help with intake and eligibility forms to see if they're eligible for the Department of Developmental Services, to see if they meet that qualification. So that's some place that you can go if the state that you live in has a family support center model. If not, you can really push for this through the school systems, because schools, they have requirements. They have to provide supports if a child's eligible for it. After 22, there's no required assistance. Supports are really just a piece of the puzzle instead of like wraparound supports that people have when they're younger. So if the person's school age, really push through that, push for intake and eligibility through the school. And if you have family support centers, those people are phenomenal in helping navigate this, because that's their job. They do this on a daily basis, seeing if people qualify for services.
Yeah. The other thing I would tell you is, like, to Felicia's point, so when our daughter was probably around 16, and Felicia would know the exact age this probably happens, she was assigned a transition coordinator. The school coordinated with the Massachusetts Department of Developmental Services, and she was assigned a transition coordinator. So that was a person that like came to our IEP meetings that we had and knew Madison and knew what her love. And so basically, and kind of held our hand really like over the next like 6 years as Madison went from like a high school into like a adult program kind of thing. And then as she sort of aged out and was there before Felicia stepped in and took over. And, you know, that person, you know, also answered a lot of questions that we had, and, you know, I mean, was an important support person for us. So, I mean, I don't know, they may exist in your state, but
yeah, the transition service coordinators, that's a great point, Dave. I just don't know if every state has the transition service coordinators. But in Massachusetts, that's huge, because they're really that first point of contact for navigating adult services. They're really knowledgeable about each of the supports that are offered in adult services, and they help bridge the gap. It's exactly what it's called, transition. They help to bridge that gap between the child services that people are eligible for to adult services. So they're kind of talking to the families, meeting with the families, meeting with the children that are in school and saying, like, how do you envision these next years going after 18 or after 22? Are you looking at home living? Are you looking at a group home? Are you looking at day program? Do you want to do self-direction? So talking about those different models and kind of seeing where people's trajectory is.
Right. And Rachel in the comments, she said per IDEA law, ages 15 and older need to have transition services addressed in the IEP process. And Yeah, in April. Oh, and Rachel, a shameless plug, her session this afternoon will talk about some of the planning services as well. So yeah, if you're able to join us after this for Rachel's session, that will be great. And then April commented that Indiana also has something similar, and it starts their freshman year of high school, so 14, 15 years old.
Yeah.
Awesome. As they should.
Yeah. Rebecca said there's a lot of talk about working with your local agency and service coordinators, but what happens if your local agency is not very good and the turnover of staff is extremely high? What other options are there for help?
That's a great question. And I would love to think that's not a reality for people, but unfortunately, it is. So first point of contact is always going to be the service coordinator. And if you're not working with somebody that's a great service coordinator, that we do have supervisors that you can reach out to, and it goes up the chain. So this, like, I don't work in a silo. I have people that I need to report to. We have to not only talk to the families, but kind of report back if there's anything that comes up as a conflict. Um, so if the office that you're working with isn't great, not just the specific person, there also are generic resources depending on where you are. Like I said, those family support centers. And it's something that you can Google or chat GBT, like services to help with special needs children in my area. Um, there are service centers that might come up. If you're not getting that support through either your local office or a family support center, I mean, we are the people. I would take it up with legislator. No change happens if we don't say something. There's a lot of families that I work with that are very fierce advocates, and if something is working well, they will let their legislator know. If something is not working well, they will also let them know, as they should. So it's really the parents and the families that are the advocates that make change and push things forward. So if you're not getting the support you need and your family's not getting the support you need, um, there's always somebody higher up that you can reach out to.
Take myself back off mute. Let's see. Okay, and April also commented that ARC has been very helpful. They have programs all over the U.S. I don't think I've heard of ARC. I don't know if Felicia, have you heard of ARC?
Autism Resource Center, because we have an ARC in Massachusetts.
That would be my guess.
The ARC is basically it's a major advocacy organization for people with disabilities in the U.S.
Okay. All right. So we still have like 13 minutes. If there's any other questions or if there's anything else that Felicia and Dave want to touch on that maybe we missed, anything that is really important with the transition, or just anything else that you guys want to touch on before we go.
I think, I will talk about a couple of things. To kind of Felicia's point about don't be afraid to advocate, there have been a number of times when I've had to appeal decisions that were made that I didn't agree with. And it's really important to do that if you feel your child is not getting the services they need. Number one, you learn even if you don't get what you want, you learn something because you've gone through the process. But I've appealed PCA hours. I mean, I had to appeal for PCA hours when somebody was, and I had to know, I had to argue how many times my child needed a diaper change a day. Like, it was like crazy. Like I had, because, Mass Health, the people who run Medicaid in Massachusetts, like they have their own way of operating, and you can't be afraid. And I didn't, I kind of said, we started off with not a lot of support for PCA hours, and now it's a lot. Now it's like 120. I worked to get that. I mean, that didn't come from just sitting around and waiting for somebody to walk in the door to help me out. That was a lot of effort, and going and sitting with the nurse who comes in and does these evaluations and saying, she needs, Maddie needs that, or no, we have to do this, or it's also really understanding how they do those evaluations, because it's important to you guys, because you rely on that support, your family does. So don't be afraid to appeal things if you don't like a decision, and because you will learn something. I had an experience of a couple months ago where we had a home nurse visit from Medicaid, and they canceled it, and I got a denial letter, and I was like, what's going on? I called them up, and they said, oh yeah, we just didn't have time to approve it, so we denied it. And I was like, and and I have a child that gets she gets injections, she now has a J tube, she's a ton of stuff, she has a lot going on medically now, and that one of I had to appeal it. It required like 17 people to get involved for like stupid errors. Like, you have to fight the system. There's a certain amount of that you kind of have to get geared up and be ready to do. So don't be afraid to do it, because that's how you get the best services. It's unfortunately, it's kind of how it works most of the time. The squeaky wheel does get grease.
Mm-hmm.
Yes, I was just going to say that. That's a great point.
Yeah, I mean, don't, it's your kid. Nobody else cares about them as much as you do. So, get out there and advocate. I mean, that's kind of a super important point, and that goes with doctors, everybody. Like, there's a lot of people who don't want to take responsibility for something, and will kind of shift you aside. And certainly, we've had to call doctors to task for stuff when we really weren't getting. It's sometimes you kind of want to be the go along, get along kind of that's I'm from the Midwest. I mean, we're kind of all like that. But I realized after 25 years of living in Massachusetts that it does pay to be a bit of a jerk. And you have to be assertive sometimes with people to really get what you need for your kid. So my general point. And if you need a lesson in that, talk to my wife. She's great.
Yeah, I think we can all agree on that. Like the advocacy part. I have not met your wife, but if I need to, I will.
Yeah, no, like she would be like, get on it, girl. Like, you have to be super strong about this stuff.
Yeah.
You don't you're not there to make friends. You're there to help you're there to help your child.
Yeah, absolutely.
So I think that's a important part of the lesson. And it's all hard. I think to give yourself a pat on the back every once in a while. I think because none of this is easy.
Yeah, I think those are all fantastic points, Dave, with the advocacy. And you're right, nobody knows your child more than you do. So really being their advocate and letting people know the things that they need, because a lot of times people are well-meaning, but services really are self-directed. So the more you let people know who your child is, what your family wants and needs, like the more you're going to get out of those services. Something that I want to add is when you're looking at adulthood, you want to be looking not just at health and safety, but also at quality of life, which is something that I love talking about. The same way that parents are phenomenal planning doctor's visits and all of the care that's required. We also want to plan those quality of life things, those fun moments like, you know, the adaptive skiing or just going, and they do a lot of adaptive sports. So they do like adaptive bike riding around here. There's a group of people that goes out in the same way that you plan to take your child to the doctor, like planning for those fun moments, because it's really going to fuel them and fuel the family too and moving forward.
Excellent point.
Yep. So I'm getting a lot of comments agreeing in the chat as well. You know, Bernie said that she's having spent 30 years now in the system. The best advice is to be realistic, be persistent, don't take no for an answer. And David's right. You don't get to pick your child's team. If someone isn't right, move on. Everyone will not be happy with you, but you know your kid best and know when it's the right fit. And Pam actually had a comment that her son does not qualify for 18 to 21-year-old programming, even though he's nonverbal and higher needs. So there's people commenting that she should challenge it, tell them to give you prior written notice for why the district is refusing transition. Do you guys have any advice on that in the last few minutes?
I do. Go out and hire somebody like a Felicia who does it on the side, and have them come to your IEP meeting with the school and advocate for you, because that sounds like bullshit. Sorry.
Love it. Nope.
Yeah.
Don't be sorry.
No,
That's what I would do.
Yeah.
I would hire somebody.
So schools are fantastic, but they're also notorious on sometimes not giving the support that's required, because it does come out of their budget. Even though it's a requirement, even though it's a law that they have to provide these services, that's why there are children's service coordinators. That's why there's transition service coordinators to really help advocate. So I would recommend connecting with whoever your representative is, whoever your service coordinator is, because they're the person that's really going to back you and say, like, these are the laws, this is what you're required to provide for services. And unfortunately, like if you guys can't fund it, like that's a you guys problem. But my child is eligible for these supports and they need to be provided. So always always advocate, because unfortunately, there are people that take the no when their child is eligible for that yes.